Hello, it's Caroline Brown here again from the University Archives, and for my third film for Well Together Week I thought I'd tell you about another project that we've done that relates to our NHS Tayside collection. In particular, this is around Strathmartin Hospital. It was a project that was funded by the Heritage Lottery, and we did it in partnership with social work at the university, with the Thera Trust, which is a charity for people with learning disabilities, and with other organisations in Dundee, including Advocating Together. But before I tell you about the project itself, I'll just tell you a little bit about the history of Strathmartin. It was founded in 1853 as Baldovan Asylum, again by charitable donation from Sir John and Lady Jane Ogilvie. And just as with the other asylums in the 19th century, the emphasis at the start was on the building itself, on making sure that it was suitable, but it also was quite elegant, and on the surroundings in which the children were housed, and on the care, the individual care in particular, that they were given. And this kind of approach continued into the 20th century. But in the 20th century, things got a little bit difficult for many of the hospitals and asylums. It was found that these big, grand buildings were no longer fit for purpose. You can see from this report here from 1915, there is already considerable overcrowding in the institution. The nursing staff is deficient in numbers. The older building is not suitable anymore. And this was the case amongst many asylums. Buildings started to crumble. Renovations were expensive. There were so many patients, it was difficult to give them that individual care that had been so successful in the 19th century. And you can see some pretty awful statistics here in point number 9. During the 11 months of the present year, which was 1915, 54 children had died. So I certainly think in the 20th century, the care that it was given in the 19th century, for many reasons, just wasn't fit for purpose. And care turned more and more to medication. This is an expert from a volume from the early 20th century, talking about new remedies, i.e. different types of drugs. And it's quite alarming when you read this, because it's obvious that the drugs were basically tried out on the patients, on the residents, and some were more successful than others. And by the end of the 20th century, drugs and experimental drug use was more and more prevalent. The buildings were crumbling more and more, and people began to question the idea of separating people from society. And they were certainly questioning the idea of locking people up in institutions like this. So in 2003, just as had happened with many other similar hospitals, Strathmartin was closed, and the residents were dispersed to be cared for in the community. So the project that we did was about talking to patients, talking to former residents, talking to staff, talking to members of the community, and recording their thoughts and memories about the care that had been given in Strathmartin Hospital. And initially the main focus of this was to make sure that evidence was captured about the care, on the assumption that the care had been at times not adequate and at times very poor. And part of the idea was to basically hold such care institutions to account. And certainly when you listen to Wilma, whose photograph I just showed you, and who is about to start talking, you can understand why we need to learn from our mistakes of the past. This is an extract from a film. Here's the interior of Strathmartin, obviously in very poor condition, several years after the residents have left. And here's Wilma telling you about her experiences.
I was didn't go with my sister, and my mum was finding it hard to cope, and that was the only place. But my mum said if she ever knew that was for An institution should never put me there. I should never have been there because really there's nothing wrong with me. The social worker took me there, said we were going for, I didn't know I was going there, and the social worker said we were going for a drive, and that's how we went. I mean, I was upset for a couple of days and that, but once you got into the routine, it was okay.
How long were you there for?
But 13 years. It was my own fault being in so long, because I was, what's that word, institutionalised, and I didn't want to go out, didn't want to leave the hospital.
So it's so important to record what happened. It's so important to listen to people's stories about what happened. And it's important because, as this amazing quotation from Nelson Mandela says, it's about shaping influence, it's about making the future. And here is Christopher, another former resident of Strathmartin, talking to Scottish Television about the project. I think as well, the fact that we wanted to speak to as many former residents and staff as possible helped people feel validated. It helped people genuinely believe that we wanted to hear their experiences, their perceptions and their stories. It reminds us that memory is all about talking to people and listening to people and recording what people have to say and then keeping that in the archives. And in addition to that, the project really brought home the idea of community and the idea of communities united by shared experiences and shared pasts. When Strathmartin was closed, the people who had worked there, the people who had resided there were dispersed. And this project was an opportunity for people to reunite and come together again and remember what had happened. And often those memories were very difficult, but this again was a safe space in which people could share their opinions and a safe space where people could be listened to. And that was the case for both former residents and for staff. Because Strathmartin had been a community, and it had been a community that developed its own identity and its own set of memories. And those memories were held in the minds of the former residents and staff. But many of the former residents didn't have those tangible things that you often connect to your memories and that you use to reinforce your memories. So they didn't have photographs, they didn't have mementos of their time in Strathmartin. So a few of the residents actually visited the archives where we were able to show them photographs, we were able to show them pamphlets and brochures about Strathmartin. And for them that was just amazing because by looking at the plans and the photographs, they could remember at least some of the good things about their time there, because many of them had resided there for many years. And here's Bobby that I introduced you to in the second film. Bobby was on the steering committee of the project. Bobby had resided in Strathmartin, and Bobby got so excited by the archives and the memories that they brought back to him that he made a film about the history of Strathmartin using the archive material. And I'm just going to show you the very beginning of it.
A DVD of the history of Strathmartin Hospital, and this is where all filmed in the archives in Dundee. And look at that, amazing, is it?
So the project, again, for me was remarkable because I get to meet so many amazing people and listen to their stories. And they were able to share their stories with lots of other people, lots of other communities and lots of other audiences. Karen Macaulay, the project leader, set up these exhibition areas in libraries and community centres around the Tayside area, and we were also able to talk about our project in the Scottish Parliament. So one of the outputs of the project was a film that was made using the memories and the interviews with communities and former staff and residents, and I'll just show you the beginning of that film just now.
up at the top.
Oh, you can get in. You can get in there. Oh, God.
Oh, these are very alright. This was nice, one thing. Oh, it's beautiful. Beautiful. Oh, it's a great big green place. There's about over 6 men, or 600 or 60 or more people in it, I don't know. So this is a dump now. The ward size, the anyways, ward 1 was long. We got order, it could be in ward 7, but before I got all these wards, I was in a bunch of what we were talking about a minute ago. But I can't say much better because it's there. And this punching was terrible. If you can't call your tabby, you're bumming us in a little room of a taxi.
So if you want to see more of the film, it's available on the website of the project, Strathmartin Hospital History, so you can see here. So I hope you enjoyed hearing about the project and learning a little bit more about what we do as archivists. Again, I just want to say how privileged we all feel to be able to preserve evidence of things that happened in the past that we can learn from, that we are able to preserve people's stories and preserve the memories of our communities. So thank you very much for listening, and goodbye.